Hi, I'm Ryan Nutter, CEO and Principal of Cornerstone Senior Advisors, and as we say all the time in our office, Medicare is the air we breathe. In this video, we're going to talk about the Medicare Supplement Plan G. What is a Plan G and why is it so important for you to understand? What purpose does it serve? So before we get into the Plan G and dialoguing on what a Medicare Supplement Plan G is, let's first back up and talk a little bit about Medicare. So when we talk about Medicare, Medicare has two parts, Part A and Part B. Part A is your hospitalization, and all these years you've been working and they're pulling money out of your paycheck for taxes, the portion of your taxes that went to Medicare paid for Part A. So it's already been paid for. I never like telling anybody, hey, Part A is free, because it absolutely was not free. You absolutely paid for Part A. It's just already been paid for. So you're turning 65 and you're going on Medicare. You get Part A because you've already bought it. What does Part A cover? So when you're admitted to a hospital, what this chart's going to show us is what your out-of-pocket exposure looks like when you're admitted to a hospital. So day one, you're admitted to a hospital, Part A kicks in, but you have a $1,600 deductible. Now I'm going to mention that these are 2023 prices. These tend to change year by year. We're recording this in 2023, so this is what these costs look like in 2023. Day one, you're admitted to a hospital, you pay $1,600. Now that'll cover you for up to 60 days. The catch with this deductible is it's not annual. So you're admitted to a hospital. Let's say you pay that $1,600. Let's say you're there for 3 days. You go home. 2 months down the road, you're back in the hospital. You pay this again. So you could pay this deductible several times in a year if it's a rough year health-wise for you. So that's kind of a catch. Now, if you're in the hospital for over 60 days, now all of a sudden you have a per day copay of $400. And if you're in there over 90 days, now that per day copay doubles to $800. And then skilled nursing is also covered by Part A of Medicare. Now I want to make sure you understand skilled nursing is not a nursing home. It's not nursing home coverage. Medicare does not cover long-term care. Skilled nursing is basically a place to recover. So let's say you've had a life event. Let's say you've had a heart attack or a stroke. Or let's say you had your hip replaced and your doctor says you're stable, but you're not quite ready to go home yet. Well, that's when they're most likely going to send you to a skilled nursing facility, and this is where you're basically going to recover. So this is where you're going to have registered nurses taking care of you, and you're going to go through occupational therapy, speech therapy, physical therapy, so on and so forth, until they decide you're ready to go home. Medicare does cover the first 20 days. So when we talk about what you pay, the first 20 days, you don't pay anything because Medicare fits that bill. After 20 days, now you have another per day copay of $200. So now you're paying $200 each day you're in a skilled nursing facility after 20 days. So you can see these costs really start to kind of add up. There's quite a bit of out-of-pocket exposure. Now let's look at Part B. Before we get into looking at what your out-of-pocket exposure is outside of the hospital, I do want to mention Part B comes at a premium. So like we talked about earlier, Part A you've already paid for. Part B, that's not the case. In 2023, your Part B premium is $164.90 a month. That can be higher based on income. That's a conversation we can have in your situation if you're worried, and they're going to look at your income from 2 years prior. So they're not looking at your income from 2022 to look at 2023's premium. They're looking at 2021. That's just a side note. If you're worried about where your income was in 2021 and you think you might have to be paying higher than the standard rate of $164.90, give us a call. We'll walk you through that and see where you're going to land. Now, Part B of Medicare, it does cost that premium. If you're not drawing Social Security, they're going to bill you this $164.90 quarterly. So take $164.90 times 3, and that's what you're going to pay every 3 months. If you are drawing Social Security, they're just going to deduct this out of your Social Security check automatically. They're not going to ask you otherwise. That's what they're going to do. So that's your first expense with Medicare. That's your Part B premium. Now, what does Part B cover? And maybe more importantly, what does it not cover? Outside of the hospital, with Part B, you have another deductible of $226. Again, these are 2023 rates. So this deductible is different than your hospital deductible because it's annual. So you're just paying this one time a year. So you pay the first $226 anytime you're seeing a healthcare professional outside of the hospital. Once this has been paid, now Medicare is going to kick in. They're going to pay 80% and you're going to pay 20%. So anytime you're going to a primary care doctor, a specialist, you're paying 20%. You end up in the emergency room, you're paying 20%. Outpatient procedures, you're paying 20%. The catch with Part B of Medicare, the biggest issue is there is no ceiling. You have no max out of pocket, so you don't have any cap to what you could end up having to pay. So let's say you end up with some health condition where you're going in for regularly scheduled treatment for several months, like cancer, you go in for chemo, radiation, things like that. Well, you're just going to keep paying 20% without any stop loss, without any ceiling. This is why we get a Medicare supplement plan. This is why Medicare supplement coverage is so important, because you can see the out-of-pocket potential that you have with just Medicare. So what are Medicare supplement plans? What the government did is they designed this chart of 10 Medicare supplement plans. And they told all these private insurance companies, all these companies that send you all this mail, they told them, if you're going to offer a supplement to Medicare, you can, but it has to be one of these 10 plans. And so what that means is these companies can't make up their own supplemental plan to Medicare. They have to pick which of these 10 plans they'd like to offer, and they can then decide also how much premium they'd like to charge. But coverage-wise, like this Plan G that we're talking about today, it's the most popular plan right now. A Plan G is a Plan G is a Plan G. It doesn't matter if you get it from Company C, from Company A, from Company B. They all have to abide by the government's rules. Pay how it was designed to pay, cover how it was designed to cover, but they're all going to charge different premium. And let me just say, this is why it's so important to work with an independent agency like Cornerstone Senior Advisors, because we are transparent. We can talk with you about every company in your area that offers these plans and tell you how much premium they charge. We'll tell you our experience with these different companies. Some companies increase their rates faster than other companies, and we'll dialogue with you on this, making sure you get the plan that you want at the right price. So let's talk about a Plan G. It is the most popular plan right now in 2023 because it offers the most coverage. So how does it work? What does it look like? Well, when you combine a Plan G with Medicare, let's look at your hospitalization, Part A. That $1,600 deductible, that's covered every time. It doesn't matter if you're admitted 4 times in a year, it's going to be paid for you every time under this Plan G. The per day copays, the $400 per day, the $800 per day, that's covered. Your skilled nursing, now remember, the first 20 days are covered by Medicare, so there's nothing for the supplemental Plan G to pick up. But after those first 20 days, each day after that, that $200 copay, that's covered for you. So the long and short, when you combine a Plan G with Medicare, if you end up admitted to a hospital, all you're going to receive in the mail is a statement of benefits paid. And there's no network. Any hospital in the United States that accepts Medicare will take this Plan G if it's a traditional Plan G, and you don't have to worry about any out-of-pocket. Now let's look at your out-of-pocket exposure when you combine a Plan G with Part B of Medicare. Now remember, you have a deductible under Part B of Medicare of $226, but it's an annual deductible. Now your Plan G is not going to pay this deductible for you. You do have to pay that first $226 each year. However, it's annual. You're just paying this one time a year. I might also mention this can change year by year. This is, again, 2023 rates. It might change next year. I'm guessing it will. It tends to vary year by year. So you pay the first $226. Once that's been paid, now anytime you see a healthcare professional, Medicare's kicking in, they're paying that 80%. You would be left with the 20%, but this Plan G is going to pay your 20% for you. So you go to a primary care doctor, a specialist, that Plan G is covering your 20%. If you end up in the emergency room or an outpatient procedure, your Plan G is going to cover your 20%. Durable goods, these are things like knee braces and oxygen tanks and wheelchairs and things like that. The rule of thumb is if Medicare pays this supplemental plan, no matter what company you have, they have to pay. So they're going to pay your 20%. One more thing I want to mention is this Part B excess charge. So basically what that means is if a healthcare provider accepts Medicare, that means they accept the Medicare approved amount for the services they provide. So basically Medicare is telling them how much they can charge for their services. Well, that healthcare provider can charge up to 15% more than what Medicare assigns them. And if they do, you have to pay the excess charge. However, when you combine a Plan G with Medicare, they would pay that excess charge for you so you don't have to worry about it. The Plan G really is dynamite coverage. I mean, you have no network. You can go to any doctor or hospital anywhere in the US. As long as they take Medicare, they're going to take this supplemental plan. You have an annual deductible of $226 and that's it. So it's really, really dynamite coverage. I mean, if you really want good health care, if you want good health insurance, because you're not going to sleep at night wondering how much your out of pocket is if you're questionable about your health care, well, a Plan G, I mean, it's going to help you sleep easy because you have very, very minimal out of pocket when you just have this annual deductible of $226. I hope you found this video helpful. I hope it was insightful for you. If you want to ask us more questions, if you want to follow up, just call our office, 316-260-3331. We would be more than happy to help. We would love to be your Medicare resource and continue to work with you year after year on your coverage, making sure you have the best fit for you and your needs any given year. I also want to mention, if you'd like a free copy of my book, Medicare Made Simple, call our office, 316-260-3331. Request a copy, give us your address, we'll ship it to you. You don't have to pay anything for it. We'll send it to you free of charge. We hope to be of great value for you. This is going to break down Medicare extensively, so we're going to talk Medicare, we're going to talk Advantage plans, supplemental plans, drug coverage, and more, chapter by chapter. So if you'd like more information, we want to be of help to you. Give us a call today. I hope you found this video helpful, and thank you for watching.